Acute stress disorder is a condition marked by the development of symptoms after exposure to traumatic life events. Patients react with fear and helplessness. They persistently relive the event and try to avoid any reminders. Usually the person was confronted with or witnessed an event which involved actual or threatened death or serious injury of self or others. The person's response involves intense fear or horror. Although a serious condition according to diagnostic criteria, the symptoms of acute stress disorder do not persist longer than 4 weeks following the traumatic event. The diagnosis of acute stress disorder typically develops at least 3 out of 5 of the following dissociative symptoms. 1. A subjective sense of numbing, detachment, or absence of emotional response. 2. A reduction in awareness of his or her surrounding. 3. Derealization, which is an alteration in the perception or experience of the external world so that it seems strange or unreal. Depersonalization is a feeling of watching oneself act while having no control over a situation. Dissociative amnesia, the inability to recall an important aspect of the trauma. The stressors usually associated with triggering an acute stress disorder episode include assault, natural disaster, war, torture, rape, and serious accidents. The etiology for acute stress disorder includes a primary causative factor, which is the stressor itself. Risk factors include personality traits, previous traumas. Some people are therefore more vulnerable, and those who can endure more stress would be less vulnerable. An inadequate family or peer support system is an additional risk factor. Being a female is considered a risk factor in addition to genetic dispositions linked to psychiatric illnesses, recent stressful life changes, perceptions of an external loss of control, and a recent increase in alcohol intake are among other risk factors for acute stress disorder. The principal features of patients experiencing acute stress disorder are painful re-experiences of the event, meaning the event replays over and over again in their head. Persons experiencing acute stress disorder tend to have difficulty sleeping, exhibit irritability, poor concentration, hypervigilance, are easily startled, have chronic fatigue, and muscle and joint pain. As nurses, we and our patients will be exposed to an abundance of stressors. Without awareness of our own susceptibility to stressors, we are ill-equipped to remedy crisis. Additionally, as nurses, knowing the symptoms, risk factors, and the therapies that can curb the insidious effects of acute stress will aid us in better serving traumatized clients.
Daily stressors are sometimes unavoidable and can constructively serve as tools for improving our self-motivation. However, when the severity of the stressors overcome our coping mechanisms, it can lead to acute stress disorder. If the acute stress disorder extends beyond 4 weeks, it is considered to be a chronic condition. The following symptoms can be indications that someone is suffering from chronic stress: upset stomach, headache, backache, insomnia, depression, intense mood swings, loss of concentration or poor concentration, and anxiety. An example of a chronic anxiety disorder caused by a traumatic or stressful event is post-traumatic stress disorder. According to the DSM-4, the basic diagnostic criteria for PTSD is as follows. The person has been exposed to a traumatic event in which both the following were present. 1. The person experienced, witnessed, or was confronted with an event or events that involved actual or threatened death or serious injury, or a threat to the physical integrity of self or others. And 2. The person's response involved intense fear, helplessness, or horror. Additional criteria state that the traumatic event is persistently re-experienced, there is persistent avoidance of stimuli associated with the trauma and numbing of general responsiveness. The disturbance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. In addition, 2 of the following symptoms of increased arousal must be met: difficulty falling or staying asleep, irritability or outbursts of anger, difficulty concentrating, hypervigilance, exaggerated startled response. These symptoms may occur after learning about unexpected or violent death, serious harm, or threat of death or injury of a family member or other close associate. Some examples of experiences that can lead to PTSD are military combat, experiencing violent personal assault, being kidnapped or taken hostage, being tortured, being incarcerated as a prisoner of war, experiencing natural or man-made disasters, surviving severe automobile accidents, or being diagnosed with a life-threatening illness. While the majority of us will experience some sort of traumatic event over the course of our lives, only about 8% will develop full PTSD. The percentages increase for men and women who serve in the military during combat time. An estimated 500,000 Vietnam veterans suffered from PTSD. When soldiers were returning home with these symptoms, the term used to describe their condition was battle fatigue. Battle fatigue was a description of a condition that had previously been called shell shock, which was coined after World War I. Shell shock was a condition that produced the 1,000-yard stare in soldiers that had been exposed to traumatic combat situations. By the time the Vietnam War was winding down, the mental health community was being barraged with veterans that were presenting symptoms of a condition that was in need of professional attention. In 1980, the American Psychiatric Association officially added post-traumatic stress disorder to its diagnostic manual of mental disorders. As a result of the most recent military offenses in Iraq and Afghanistan, there has been an increase in the percentage of PTSD cases reported. 1 in 5 soldiers today will be treated for PTSD-related symptoms. For some, treatment will never be realized. Suicide rates among soldiers returning home today are at their all-time highs. In 2009, more than twice as many U.S. servicemen and women committed suicide than were killed in combat in Iraq. 2 days after the September 11, 2001 attacks, Private First Class Joseph Dwyer felt it was his patriotic duty to serve and defend our country, so he enlisted with the Army. He served as a medic assigned to the 3rd Infantry Division's 7th Cavalry Regiment, a unit that was used to fighting on the front lines and would see plenty of combat. During an interview, Dwyer told Newsday, "It took 21 days to get to Baghdad. We had 4 days that we didn't get shot at." Dwyer would make national headlines when this photo of him made its way onto the covers of most major national newspapers. For some, this photo personified the role that the United States played in Operation Iraqi Freedom. As time passed and Dwyer returned to civilian life in the States, he would have a hard time dealing with the hero label that came with this photograph. He was no longer in the military, and the adjustment to civilian life would be a tremendous challenge. His wife could sense that something was not right with him. He did not seem to be acting like himself. He was showing the classic signs: withdrawal, irritability, he was drinking heavily, and his sleep was interrupted by the unrelenting nightmares. The local police knew his address well because of the numerous run-ins. On one occasion, the police were called to Dwyer's house, and when they arrived, he began shooting at them because he thought that they were Iraqis. After living in fear for over 4 years, his wife left him. 3 days later, he was rushed to the hospital for a drug overdose. And this is where he would later die, at 31, leaving behind 1 daughter. It is frustrating to think that despite his pleas for help, Dwyer never received the proper treatments that may have prevented this tragedy.
Josh's 10 tips for stress management. Number 1, smile. When we smile, our face muscles relax and it immediately sends a signal to our brain and makes us happy. Don't wait for an opportunity. Just fake it. Number 2, meditate. Meditation helps calm down nerves and helps you connect with your true nature. This helps you to stay grounded. Number 3, exercise. Exercising draws out the blood and energy from the brain and brings it to the body and legs. This relaxes the brain and energizes the body. As a result, you feel good. Number 4, be grateful. The more you focus on things you don't have, the more stressed you'll be. Just change your focus to things you are grateful for and see the difference. Number 5, eat healthy. Junk foods like refined flour and sugar drain off our vital nutrients from our body and sap our energy. Eat more veggies, fruits, and fresh food. Number 6, distract yourself. Simple distraction like getting involved in a game or some fun activity can work wonders. Number 7, breathe right. Make a point to take slow, deep breaths whenever you are stressed. You'll feel the difference in minutes. Number 8, right posture. Stressed people usually have a curved spine. As a result, your lungs cannot fully expand, and they work less than almost 30% of their capacity. The result is less energy and fatigue. Number 9, get a massage. A weekly oil massage can work wonders in releasing stress and improving your well-being. And number 10, spend time with happy people. Laughter is contagious as well as stress. Just like happy people make you happy, stressed and depressed people can make you more stressed.